And also mentioned to my doctor before I had the surgery, I told him that I had a problem with after I'm put to sleep. A couple of days later, I end up in this like deep, dark depression for some unknown reason. Sort of like people say, kind of like after they've had a baby, like postpartum depression or whatever. So the doctor's like, he has no earthly idea what I'm talking about. So when the anesthesiologist talked to me before I had the surgery, I mentioned it to him, and I said, you know, look, I saw this on the news about a year ago that it's becoming, you know, more and more to life, so to speak. More and more people are complaining about the depression after being put to sleep. And the anesthesiologist, he knew exactly what I was talking about, and he explained it to me. He said they use 3 or 4 or maybe 5 different kinds of steroids. You know, like to try to wake us up, you know, once we've been put to sleep, to prevent nausea and different things. And he told me one, and I cannot remember the name. It was a name about, you know, this pronounced, and it was about this long. And he named that steroid, and he said what is happening is when they give you all these steroids, like I said for myself, for example, I've been up all night, then I've been up all day. They gave me, you know, I've been put to sleep. I've been on all this pain medicine by injection, and then all this pain medicine by pill. And see, I've done, you know, been up, like I said, all night and all day, and it's like my brain is, you know, which I'm fully alert, but it's like my brain is in overdrive. And, you know, the anesthesiologist was talking to me about that, and he said that's what those steroids are doing. They kind of put your brain or your body, it gives you all this excess energy, these steroids. And then he says, yeah, and then a couple of days after the surgery, you know, if you don't get more of that drug or that steroid, he said your body or your brain, you know, will actually crash. And he said, you know, that's what's going on, and that's what's causing the depression. He said your, you know, body and your brain would just actually crash about, you know, 2 days after the surgery because you're not getting any more of the steroids. So I just, you know, like I said, I've had different ones to ask me those questions about being put to sleep and depression. I just wanted to, you know, let you know what I found out from my anesthesiologist, and yeah, it would be really worthwhile to mention it before you're put to sleep to your anesthesiologist, because mine, I forgot the name of the one that he was telling me about that helped prevented the nausea, and he asked me if he, you know, just not to use that because he felt like that was one of the main ones that caused the depression. And I said, well, yeah, I'd rather have, you know, nausea and do a bunch of throwing up than to you know, of course, being depressed. And now whether he actually, you know, cut that steroid back or not, you know, I don't know. I'll know in about 2 days, you know, if I fall into that deep, dark depression. But, you know, hopefully I won't. But I just, you know, wanted to, you know, that's something that you should always, you know, ask your anesthesiologist about. I don't know if it's something they may be able to work around, but you know, like I said, the depression after being put to sleep, it's not fun at all, and you don't know why you're depressed. It's well, like the anesthesiologist said, you know, your body and your brain just kind of crashes, and so I just wanted to let you know that was pretty interesting.